January is Cervical Cancer Awareness Month, and it's a time when we can sit down and discuss ways for this highly preventable cancer to be screened, diagnosed, and treated. Now, most cervical cancers are caused by persistent infection with a certain type of virus. It's called the human papilloma virus, and this is a common virus that gets transmitted through sexual contact. But here are some ways you can prevent and screen for cervical cancer. First, HPV vaccines. These are highly effective vaccines in preventing infection with most cancer-causing forms of the HPV virus, and they're actually recommended for both boys and girls starting at the age of 11 to 12 before they start becoming sexually active. But it can also be recommended for young adults up to the age of 26, and sometimes even for people up to age 45, depending on their individual circumstance. Second, screening for cervical cancer. This is a pap smear, which is a test that looks for precancerous or cancerous cells on the cervix, and it's recommended for all women, starting at the age of 21, and then every 3 years thereafter, depending on the results. And finally, we need to work to minimize risk factors for cervical cancer, like smoking, or having multiple sexual partners, or long-term oral contraceptive use. The survival rates for cervical cancer are very high at about 92% at 5 years after diagnosis if it's picked up early. So let's work together to ensure that all the women in our life are vaccinated and screened, and even the men in our life go out and get that HPV vaccine.